itself. The first is the actual handpiece. So the handpiece itself, you can tell I'm not a very large person. It fits smaller than the size of my hand. It's really easy and light and weight to be able to take care of. It turns on and off very simply, and it has a very easy to use interface that's right on the front of the device. The attachment pieces are housed in a pre-warming device that we can see right over here. I'm actually going to take it off for just a moment. This pre-warming device actually warms up the attachment pieces to the proper temperature to do the procedure so that the device itself doesn't have to waste a lot of battery power to continue throughout the procedure time. So I technically like to keep my device right around 50 degrees Celsius so that it is just about at the level to be able to do a nice warm debridement and warm expression of the glands. And that was one of those things that's unique about the MGrx. If you hadn't noticed, it is cleaning, it's warming, and it's expressing. But all of the steps in those procedures are all being warmed continuously. So we're actually getting a heated debridement, a heated massage, and a heated expression all the way through to keep that meibum liquid. If you don't know, that meibum itself, once you heat it up to the proper temperature to be expressed, actually cools back down to its thick, inspissated type of consistency after anywhere from 2 to 10 minutes. And most people, it's 2 to 5 minutes or so. So we have a limited window in being able to express everything that we need to out, or else we're just going to leave the clogs right in there. And MGrx solves that problem by allowing us a little bit more freedom and time to be able to work with. So we're going to get started today with a patient who is a friend of mine and has graciously donated her eyes to be able to be part of the procedure for us. And I also have my technician, Erica, here to be able to help out with the procedure. Sherry and Erica, we have you right here as well. And so we're going to walk through the basic steps of the procedure first. Essentially, it's recommended that at the beginning of the procedure, we're going to drop the patient with proparacaine. We're going to get started by giving them just a little bit of extra comfort from not having to feel the device itself, make it nice and easy to be able to perform. So if you go ahead and drop. Yeah, perfect, perfect. And while she's doing that, I'm getting the device ready. And so the device itself, when you turn it on, it has the screen up to the main loading screen here as well. If you double click on the device, if you double click on the device, what we end up seeing is actually almost like a settings logo that's on the front that's clicking back and forth with a picture of the applicator that needs to be inserted at that time. So the beginning of the procedure is always going to start with debridement. So that's going to be the first one to cycle through. Once we put it in, already warm from the device, it clocks in, we hit the button again, it beeps, and it's ready to go. If the buzzer's flashing a little bit, it just means that the device needs to continue heating up that debrider up to the proper temperature, and will take just a couple more seconds while we're getting the patient ready. So I'm going to hand the device to Erica right now while I glove up and get ready to go. So at this time, Sherry's going to be feeling pretty good from those proparacaine drops. The eyes are probably feeling nice and heavy. And I'm sorry, I can't prescribe those to you. We can only use one a day, maybe two if you're lucky. All right. So the debridement of the device is really easy. We actually don't even need to add in any extra cleansing gel like some of the other debridement devices that are on the market. Because of the heated debridement, this actually takes off the biofilm well enough just with the device itself. And so for doing the actual debridement, what I'm going to do is have Sherry look up to the ceiling for me and try and keep her eyes open as we can. The tip of the device itself is kind of like a golf club spud. And so on the outer edge of the golf club spud is going to be our sharp surface to do some of the debridement. It's not too sharp where we're at risk of cutting or damaging the epithelium, but it is sharp enough to be able to debride some of that bacteria. So what I'm going to have you do, Sherry, looking up to the ceiling. And as I open up, I'm slightly everting the lid, and I'm just kind of brushing aside. I think Sherry's a little ticklish. That's okay. We kind of expected. It's okay. But as we kind of go through, all I'm doing is swiping back and forth, usually going one direction and then back the other. Yeah, so the beeping there is just letting them know that the device is at the proper temperature. And just cleaning off the biofilm. The reason I'm doing this, for those of you who are not aware, is because I'm clearing the caps, right? We can't really express a gland all that well that has been capped off by biofilm. All that meibum is going to be trapped inside, and it's like trying to squeeze a tube of toothpaste with the cap still on. It's not nearly as effective. And so getting the opening clear is going to be key into having her feel a little bit better. So for the upper eyelid, what I'm going to have you do, Sherry, is actually look down for me. And again, I'm going to slowly invert the lid a little bit, and I'm going to flip the device upside down so I can get to that sharper side to be able to debride the biofilm. And I'm basically just going to play a little mini golf, right? We're going to be brushing along the side, clearing the way. Okay, I'll let you blink a few times. That's okay. Perfectly fine. That's what eyelids are there for. They help us blink, all right? So, same thing. And we are cleaning all around the side. And that's really all it takes, because this is a heated debridement. It doesn't take much to actually debride off the biofilm. A couple swipes back and forth is enough to clear the caps and the openings and getting ready to go. So just for time and convenience's sake, we're going to just be doing the one eye on Sherry for today. So I'm going to switch to the next step in the actual device itself. And so when switching to the next portion of the device, we double click the button on the front of the device, and it's going to go back to that logo to be able to switch to the next applicator. So Miss Erica, if you would. All right, and I'm going to trade you. We just take the tip of the device. We're going to add it right back in, click it in place, and double click one more time. When it beeps, it's getting ready to go. And to be able to start a timer for the warming that's already set into the display, we just hold the button a little bit, and it's going to start a timer that's going to beep every 30 seconds for us. Essentially, what we're doing is warming the eyelids for 30 seconds for each lid so that we can liquefy the meibum. Now, to make it a really effective warming process, I'm also going to be adding a little contact gel to the tip of the device. So for those of you who already have IPL in the office, it's kind of the same contact gel that you'd be using for that procedure. A water-based ultrasound gel is perfectly fine. What we do is put it on the tip and then massage that into the eyelids for the 30 seconds for each lid. So what I'm going to do, oh, you have some ready for us? All right, thank you so much, Miss Erica. That's why I keep her around. She keeps me on top of everything. All right, and you don't need much. We really don't need a whole lot of gel to be able to goop up the whole area. So what I'm actually going to have you do for this, Miss Sherry, is to close your eyes for me, okay? You just keep them closed and relaxed. Now, the way that the device is shaped itself, it has a half moon shape to mask the tarsus. So you just want to make sure you're having that horizontal edge down near the lid margin as we go. So I'm doing this for about 30 seconds. Not much. It feels just like a massage, kind of a spa treatment. And you'll know that the glands are getting warm enough because the skin will start to flush a little bit. On those lighter skin patients, you'll start to see a little bit of redness accrue right along that eyelid and lid margin. That's when we're starting to get warmed up and ready. Gonna have a little bit more of the contact gel, Miss Erica. Thank you. Perfect. And then still keeping your eyes closed, Sherry. Now I'm just gonna massage the upper lid. So again, doing this for 30 seconds. It's not too much pressure in there. Yes, we're massaging a little bit. We're not trying to push the globe down like we're trying to do a scleral indentation or anything like that. This is more just to warm up that meibum that's inside the eyelids. All right. And you can see, if you can look real close, the eyelid getting a little warmer, gets a little bit red as we go. Perfectly natural to happen. And that means we're doing a good job. All right. So once we're done, just to make sure that none of the contact gel gets in the eyes, at this point, I normally have a technician come by and actually clean off the contact gel a little bit. before we do the expression. So I'm going to have Miss Erica do that for us while I switch to the next phase of the device. Okay, thank you, Miss Erica. All right, you can come on through. So while the mybome is nice and warm, I'm going to start with the expression. Now with the expression, we want to make sure that the red part is the part that's heated, is the part that's going on the outside. This is an external heating and expression that we do throughout the procedure. And for this, Ms. Sherry, what I'm going to have you do is open up and look towards the ceiling. Now, my technique for expression may be slightly different than yours, but what I like to do is do 3 different zones, temporal, central, and nasal for each lid. And I try to go from bottom to top in each expression, just to make sure that I'm getting the most out of my expression as we go. So if you would, look up to the ceiling here. And as I pull down, I can even feel through the gloves, her skin's nice and warm. And I'll just do a gentle squeeze. 1, 2, and 3. Okay, same thing. I'll do it for the central a little bit. 1, 2, and 3 here. So she's got nice clear mybome. She's been taking her omegas and she's been doing a great job. Probably not as easy to view on the video, but I'm happy to see that in one of my favorite patients. Same thing here. 1, 2, 3. Yep, and just making sure that we're getting all those zones for each side. Same thing for the upper lid. Now what I'm going to have you do, Miss Sherry, is look down for me. And as we go, 1, 2, 3. Okay, blink a few times. Same thing, still looking down. I'm going to come in the center part. 1, 2, 3. And same thing, one more time. 1, 2, and 3. And that's about it. So in that amount of time, yes, we only did one eye, but in probably 3.5 to 4 minutes, we'd completed one eye, maybe add in an extra 90 seconds to 2 minutes to be able to do the other eye as well if we're going back and forth in between the two. But within 5 to 7 minutes, we've got a lid cleaning and lid debridement technique all put in one. Thank you so much, Sherry, for being a part of it. I'm going to go back over here. Thank you, Miss Erica. I'm going to give you that back to put on the charger. So overall, as you can see, the MGrx has not really been an impediment to our workflow at all. This is something that can be done in between patients. I can have somebody set up in a separate exam room, ready to go for debridement and warming, and then jump back into the next exam. I can schedule their own time slot so that we can talk through it a little bit more if I know a patient needs a little coaching to be comfortable with a procedure here in the office. It allows a lot of flexibility within our office, also with a very small footprint. It's not as obtrusive as some of the other devices that are there and allows us to have a lot of freedom and flexibility.